This morning in Coffee with Dan, I have Dr. Sanjeewa Ranaweera. He's a MBBS graduate of medicine and is a specialist in public health. He's a member of the expert committee on tobacco, alcohol and illicit drugs of Sri Lanka Medical Association and a member of the Presidential Task Force on Drug Use Prevention. With the introduction, I'm sure that the listeners can imagine the topic that we are going to discuss. It's the issues relating to the use of drugs and alcohol. Good morning, Dr. Sanjeewa. Welcome to the studios.
Good morning, Dan.
To start our discussion, may I know what's the difference between prescribed drugs and illicit drugs?
It's actually a matter of legislation. Now, prescribed drugs are usually drugs that are given for specific illnesses. Illicit drugs are drugs or substances that have been banned by law because of its social and health consequences. But once again, some people use prescribed drugs for reasons other than the ones that are ascribed to those drugs. So then you can sort of define that as also illegal use. But basically, prescribed drugs generally have good effects because they are given for different diseases and they are effective for treatment of different diseases. But illegal drugs have no such beneficial effect at all.
This is what, in fact, I thought that some users prescribe drugs for various other illegal or illicit uses, and that cause problems in the entire use of proper drugs in illicit ways. Now, what are the reasons that we should address preventing or reducing drug use?
Well, then there are many reasons because when you look at when I'm talking of drugs, I'm not talking of prescribed drugs. I'm talking of substances. It may be alcohol, it may be tobacco, it may be opioids or whatever the illegal substances. These substances are harmful. Harmful in the sense they are harmful to the health of the people as well as the economy. And as far as individuals are concerned, there is also, in addition to the physical health harm, it harms their well-being. Because if you look at users, some of the addicted users, their well-being is totally, destroyed by these drugs. So therefore, the main reasons that we as doctors see that why we should address this is that the health harms, the social harms, the economic harms. If you look at the so-called legal drugs in this country, legal substances, basically tobacco and alcohol, they usually take a huge toll in our society. For example, if you take tobacco, the Ministry of Health estimates 20,000 people die every year. That's about 60 people a day. 60 a day. Alcohol also, they come up with a similar sort of estimation. And when you take things like alcohol, I personally feel that the social harm of alcohol is much more than the health harm, because in addition to the health effect it causes, it will also cause things like accidents, which we see very commonly in our country. It's a very, very well-known factor in suicides in this country. The attempted suicides are very high in this country. And it is also a factor in things like domestic violence and other forms of injuries. Therefore, these substances have many I would say, dimensions where it can harm the people and harm a country. Now, we did a study on, now people talk in terms of economics now. So we recently did a study where we found that the harm from tobacco and alcohol use in this country amounts to more than 210 billion rupees every year. 210, which is a huge amount. Now, if I try to put it in perspective, the entire southern highway cost only 750 billion rupees. The airport highway cost less than 100 billion rupees. So now I'm talking of a cost which occurs every year, 210 billion every year. We calculated for 2015. Now we are recalculating it for the next years also. So you can see the amount, that we lose every year simply because we use these substances. It's the loss that is caused by premature mortality when people are unable to work, where the government has to subsidize their medical bills. So it's an issue that I think all Sri Lankans should take very seriously.
Now, there can be realistic costs as well as whereas unrealistic costs, such as the ones we don't pay actually. Now, considering the realistic costs, what is the annual health sector expenditure towards these kinds of ailments that occur with the use of illicit drugs in this country?
If you look at the health expenditure itself, a basic estimate could be about 40% of the overall direct cost of health. It goes for these two substances, according to the estimations. So it's huge, whichever the way you look at it. And if you come down to the family level, right now, if I try to bring it down to an individual level, we Sri Lankans spend about more than 100 billion rupees in buying cigarettes. Just buying, right? Not spending on illnesses or anything else, just buying. Now you can imagine what an impact it can have in a family where the income is low, right? In some areas of the country, we have done surveys with people which show that hundreds of thousands of rupees are spent each month from small villages. Right? They never get this back as development aid or samurdhi or whatever. All the costs related to tobacco and alcohol is much higher than the amount that they get as subsidies for maybe agriculture or development or poverty alleviation. So it's a not only a individual health issue, it's a social issue where the levels of poverty is perpetuated or exacerbated. And it's a major drain on our development efforts. So those are some of the macro level factors and individual level factors why we should address this issue.
What are the reasons that we should address preventing or reducing drug use?
Well, there are many ways that you can prevent people from taking drugs. One of the most popular sort of ways is actually educating them about the harm, which for most part is not very effective, although it's very popular. Because if you look at our country, many people who take drugs, it could be tobacco, it may be alcohol, it may be illegal substances, they know that it is harmful, but they still take it. So therefore there are different ways of addressing this issue effectively. First of all, of course, when you look at a country, there should be policies that discourage people from taking these substances. There are many country level things that you can do. And I'm very glad to say that as far as Sri Lanka is concerned, we are far ahead in policies as far as tobacco and alcohol is concerned when you compare to countries even in Europe. So we don't allow advertising, we don't allow point of sale, we don't allow sales to children under 21, we don't allow sales from vending machines, and we don't allow use of tobacco in public places, and even for alcohol we don't allow advertising. So the policy environment, I would say, is good. But other factors, the personal factors, I think should be addressed more, because now we are moving towards trying to curb this, because the government has very clearly stated that they want to reduce the harm from alcohol and tobacco. So we have to work especially with the groups that are already using these substances.
Since you mentioned the fact that these drugs are freely or considerably available in the European countries and other developed countries. Now, I understand that in those countries, some people who are into very rigorous and bulk type of work, they prescribe these certain drugs as a painkiller in some circumstances, but at the same time they also give very good education to their general public on how to prevent the use of drugs. So considering these aspects, why do people use substance despite knowing that it is harmful?
Yeah, it's a good question, Dan, because when you look at, if you look at our syllabuses in grade 6, 7, 8, all of them teach children about the harm of drugs. So all children coming out of school know that it is harmful. And when you survey users of alcohol and tobacco, over 90% of them say that they know it is harmful, but they still use it. So there are other reasons why people use drugs. Basically, there are so-called, symbolic values attached to drug use. And they perceive certain chemical effects of drugs. And also there are these group norms that perpetuate drug use. Now, for example, if you take alcohol, it could be seen as a symbol of adulthood or symbol of friendship, or especially now in this country where now whatever whatever we think, right? The majority of Sri Lankans do not use alcohol. The majority, right? That is, surveys show that less than 40% of males are current alcohol users, right? And less than 1% of females. So if you take the two together, more than 75% of us do not use alcohol, right? This is something that we don't realize, right? Therefore, there's a huge market for the alcohol industry to, exploit. And so these symbolic values, the perceived chemical effects, and the group norms are being perpetuated to ensure that new people start using, and groups that do not use alcohol usually start using, because one of the biggest targets of the alcohol industry is females in this country, right? They try to market alcohol as a symbol of sophistication or liberation or whatever. So I think very few less perceptive females have fallen to it, but the vast majority has not fallen for it. Now, if you take cigarette use, right? At one time, it was a sort of aspirational. You would have, you would remember it was an aspirational thing to be seen with a cigarette, right? So that's the symbolism attached to a cigarette, where you smoke as if you are the lord of the world, and now it is not so, because people realize that people who think tobacco use is sophisticated are actually idiots, right? Because they are the people who have been fooled by the industry propaganda to think that this harmful and noxious substance is actually cool. So the main reason, the main answer to your question is, Dan, that people knowingly use harmful substances because they ascribe different values to it and are unable to resist the sort of the social normalization or social pressure from their groups to consume these substances.
So in connection to what you said, are there any specific factors that push people to use drugs and alcohol?
Yeah, basically there are. Now, the one thing that I touched was the currently the most, I would say, pervasive factor is alcohol industry and tobacco industry led promotions. I would not say advertising, because advertising is banned. But if you look at films, right, you see many actors smoking, very glamorously. Alcohol use is the same. If you look at social media now, alcohol industry has heavily invested in social media. Facebook, maybe Twitter. If you look at Instagram, you see images of alcohol. And marketing through the social media is a very interesting subject, because you get the users themselves to do your dirty work, right? The advertising strategies are so sophisticated that unknowingly we market things that the advertisers want, right? So if you look at all the images that you get in the social media of alcohol use, it just glamorizes heavy drinking, right? It markets it as fun as a symbol of friendship, right? And the industry itself has its own pages, and in some pages the likes are like 10 million, 20 million. So it's a sort of a very insidious method where the users of social media who think that it's their own will and they are using it properly, but they are the actually people that are being used.
Doctor, what should be done to reduce harms of drugs and alcohols?
Many things can be done to reduce harm from alcohol and drugs. Starting with, of course, as I discussed, national policies where advertising should not be allowed, the taxation should be increased so that people find it less affordable, and children should not have access to these substances, and there are many other things. But what really happens is when a government like the Sri Lanka government, when they try to implement a reasonable and very effective law or a policy, there are lots of myths created by the industries, alcohol industry and the tobacco industry. They say that now, for example, if you increase the price of alcohol, illicit alcohol use will go up. They say you have to bring down the price of beer to control illicit alcohol, which is totally false, because no beer user will go to drink kasippu because the beer price was high. And these arguments look reasonable on the surface, but they're absolute rubbish, right? And in Sri Lanka we found that during the last 5-6 years illegal alcohol use has gone down dramatically, because illegal alcohol use does not depend on the price of the legal stuff. It depends on the level of enforcement. All illegal activities depend on the level of enforcement, not on the they don't depend on the legal stuff. So therefore, one area that we have to be very careful of is countering the industry myths which impede lawmaking. And on the other hand, the other factor that we have to be very careful about is that, as I said, the vast majority of Sri Lankans do not use alcohol, 75%. And the large majority, about 85%, do not use tobacco. Right? And Sri Lanka is one country where the youth tobacco use is the lowest in the world, where the WHO does studies in about 130 or 140 countries. Sri Lanka has the lowest rate of smoking among the 13 to 15-year-olds in the entire world. So we have to make sure that we protect these rates. So anything like if there's talk of government allowing beer to be sold all over the place because tourists are starved of alcohol, or that the illicit the beer prices should be reduced because of illicit alcohol, I think those are things that should not be done by a government, because we are already in a good position and we should never try to give away a position of advantage.
Now, you being a member of the Presidential Task Force on Drug Use Prevention, what's the main objective and functions of this task force?
Yes, this task force was appointed by our president because he is very keen to see that the harm from alcohol and drugs are actually eliminated from Sri Lanka. So this particular task force is a coordinating mechanism where experts as well as implementing agencies, like it may be the heads of departments of customs or the Director General of Health Services, Army Commander, Navy Commander, Secretary Defense, Secretary of Finance Ministry. It's a very high level committee appointed by the President, which meets and discusses mechanisms to reduce, because most of the time, Dan, most government agencies work in silos. Right? They do whatever they are supposed to do and do not sort of interact with others. So to break that cycle, the President has appointed this, and I think it has been quite successful so far in the country.
My final question for today to you, Doctor, what is the advice that can be given to a tobacco and alcohol user?
Yeah, for a tobacco user, it's very, very simple, right? You just give up, you stop, because there's no known safe level of consumption of tobacco, right? 1 in every 2 tobacco users die from a disease caused by tobacco. Tobacco causes many diseases, which includes cancers, which includes heart attacks, which includes so many things. You name it, tobacco causes it. So the best is just stop it, and 99.9% of the time you can just stop it. right? Some people say it's very difficult to stop, but if you look at Sri Lanka, almost all people who has given up smoking has just given up spontaneously, and it's a matter of not lighting up again. And if you want to make sure that you don't light up again, you have to get hold of some friends who smoke with you. If a group gives up together, I'm quite sure the effects are much more pronounced. And as far as alcohol use is concerned, now people try to justify alcohol use giving many reasons. If you look worldwide, alcohol is a major cause of death by heart disease, but people say it protects the heart. But if you look at the real research which are done by independent people, there's no such protection. Alcohol does not protect your heart. Even the American Heart Association or the British Heart Association says do not take alcohol to protect your heart. There are other ways, easier ways, right? Give up smoking, have a good diet, go for walks, right? So therefore my advice to alcohol users is also minimize use. In alcohol, there's no safe level for consumption for cancers, whatever the level of your consumption. Right, you can get cancers related to alcohol, and cancer related to alcohol is also very common in our country. So my advice to both is tobacco, stop immediately. Alcohol, reduce as far as possible. The best advice is to stop. And there are reasons why people can't stop alcohol use, because when you go to a party, you are pressurized to use, and unless you use sometimes people find it easier to use than not use because of the social pressure you get, right? And we all know that alcohol is not a very tasty and nice smelling or sweet substance. That's why we put various things to it to make it pleasant. It's an unpleasant substance, but taking that unpleasant substance is sometimes more pleasant than listening to people who are less perceptive pushing you towards use. And so that's the main reason why people sort of find difficult to give up alcohol use, because of the less perceptive amongst us push others towards use, right? If you look at alcohol taking situation, we'll find that people who are not really perceptive in real life, or not very efficient, or not very happy, are the ones that dominate the alcohol scene. When you start taking alcohol, they are the ones say, "Machan taveka gamu kam vaya you wife to buy the." And if you look at the people who do that, they are actually the people who have been most fooled by this alcohol industry propaganda, as well as the perceived chemical effect of alcohol. And alcohol, as we all know, it's a depressant. It's not a stimulant. That is why 1 hour after use, you can't drive. You feel sleepy, right? You want to vomit. Right? That's the real chemical effects of alcohol. The alcohol, whatever the amount you take, right? It takes 45 minutes for it to be metabolized in your body and to have its effects. The effects that you feel and see before that time are the psychological effects, not the chemical effects of alcohol.
All right. In today's Coffee with Dan, we discuss issues relating to the use of illicit drugs and alcohol with an expert in this field on public health, Dr. Sanjeewa Ranaweera, who is a member of the expert committee on tobacco, alcohol and illicit drugs in Sri Lanka Medical Association, and he is also a member of the Presidential Task Force on Drug Use Prevention. Thank you very much, Doctor, for being here this morning in Coffee with Dan. And with another interesting topic, I will join tomorrow.
Coffee with Dan.